Cardiovascular disease remains the #1 killer in this country, and one of the most commonly seen cardio conditions is AFib. In irregular heartbeat, it leads to a higher risk of stroke.
The risks are completely different depending upon a variety of issues, including the history of prior stroke, heart failure, high blood pressure, diabetes, vascular disease, age, and gender.
With the help of a risk calculator, doctors assess each patient. Much research and development is being aimed towards AFib, but the simple truth is that one of the most basic, time-tested treatments remains the best first-line approach.
In 2014, the American College of Cardiology and the American Heart Association released guidelines on treatment of patients with atrial fibrillation. In most cases, patients with minimal symptoms are recommended to be treated with control of the heart rate and also anticoagulant blood thinners to reduce the likelihood of having a stroke.
At the same time, advances are being made in surgical treatments for AFib. R&D is put to use on developing new drugs. These medications are easier to take than in years past. The hope is more people who need them will find drug therapy easier to swallow.
Their advantage is a reduction in the likelihood of interaction with other medications, a reduction in the likelihood of interaction with certain foods or beverages that can be problematic with warfarin or Coumadin, and importantly, the lack of need for regular blood tests to monitor the control of the anticoagulant.
A risky condition. Your doctors can recommend the right line of treatment for AFib that will reduce stress on your health. For Lee Memorial Health System, I'm Amy Osher.